Hi, my name is Steve Kess. I'm the Vice President of Global Professional Relations for Henry Schein, and we're here at Project Accessible Oral Health in Philadelphia, Pennsylvania. And it's my privilege to introduce my guest, Dr. Larry Paul, who is the Vice President of Clinical Dentistry at AmeriHealth Caritas. Larry, it's great to have you here. Thanks for joining
My
us.
pleasure, Steve. Thank you.
So one of the key things that we wanted to talk about today is if you can give us a little background on yourself and your current role at AmeriHealth, that would be great for the audience.
I've been with AmeriHealth Caritas about 8 years. We are a national company providing public programs, primarily Medicaid, in a number of different states. I head up dental programs there. I came to be aware of this particular issue through a program that PAOH had, I guess about a year and a half ago. A program both at the Viscardi School and also at NYU. That really opened up my eyes to the issue of which I was unaware, the issue of the significant gaps and barriers in providing oral health care for people with disabilities. Very impactful program for me, particularly in terms of hearing the stories of actual people with disabilities, different types of disabilities, and their caregivers. Very, very impactful. So literally on the way back to Philadelphia from that meeting from NYU, I thought about what I might be able to do to help with this issue. And my thought was that the issue was of such a grand scope, and the number of 57 million people being affected with a disability. My thought was the solution needed to be done on more of a local level and less so on a national level. So came back to my company, had a number of different conversations with different leaders, and started to think about what we could do in the Philadelphia market to start. That's where our headquarters are. That's where we know a significant number of stakeholders. We have 2 dental schools with whom we have very, very strong relationships, a lot of community relationships that we built up over the years. And my thought was, let's try to develop a program to address this need, and started in the Philadelphia market, in Philadelphia and the 4 suburban counties, and aspirationally take that model that we developed and take it into other markets.
And Larry, when you joined PAOH as a third-party payer, you were part of a public-private partnership of industry, the philanthropic community, caregivers, dental schools, as you point out, and NGOs. And with your expectation coming in, what were the 3 top challenges that you thought the issue related to as your organization might be able to address? So I'm aware of one. I'll point them out to you, and then you can answer them specifically. Okay? And so one is there's a lack of oral health literacy by the public. And so from your perspective as a third-party payer for dental service, how did you approach that, and what was the benefit for you and the policyholders of your company?
Well, the first thing we did was to create a coalition. Coming out of the conversation at the Viscardi Center at NYU, sort of the mantra of the disability community that really has resonated with me throughout, and it's been a year and a half, is nothing about us without us. So the idea of putting together a program without extensive consultation and communication and collaboration with the disabilities community was something that we were not going to tolerate.
Right.
So we started off creating a coalition. That was really the first step. A coalition in the market of local stakeholders, agencies, advocates, governmental folks, providers, some funders, anybody we could think of that would be additive to the conversation around the issue.
And
so that was really the first step.
How did that go? Was it well received?
That went exceptionally well. I think we had about 50 or 60 organizations. They're very, very interested. You know, it's interesting. I, as sort of a person disconnected from the disabilities community, did not have awareness of the issue and the scope of the issue. In talking to people in the disabilities community, they understand fully. And it is one of the major issues, the most significant issues that they will articulate.
Right.
The inability to get community-based quality dental care.
Excellent. And what about the other challenge within that context, that reimbursement for the health provider, given their need for skills as well as the amount of time it takes to serve a patient, the oral health needs of a patient with disability? How did you both address that, and how did you try to resolve it?
Well, nothing happens without access to care, and in a Medicaid dental environment, access is always a challenge for us, even with neurotypical members.
Right.
So in talking to our providers, and we do have a fairly extensive network in this market, the 2 chief concerns that they articulated to us were the reimbursement concerns, and that was understandable to me, Steve. The idea that somebody, particularly with a cognitive disability, comes in many cases they're just not going to have the ability to, for lack of a better term, plop down in the dental chair and open their mouth, as oftentimes neurotypical people can do. They need to be acclimated to the environment. Oftentimes there's additional staff that's needed, there's additional time that's needed. So it was clear to me that the compensation issues were important. And we created a compensation model that we think addressed a number of those issues.
And you were able, as the champion of the program, to convince your management to pay more to serve this segment of your patient population.
Yeah, and that was a challenge as well. You're talking about the challenges. I work in a fairly discordant organization. That's not the proper word, but a multifaceted organization. Our members in this market cross 3 different product types. Medicaid clearly is the largest. We have a Medicare, a D-SNP Medicare plan, and a new program now in Pennsylvania for people with dual eligibility, Medicare and Medicaid. And we have many, many members with disabilities in all 3 of those plans. All 3 of them have different management structures, different ways to outreach to members. So for me, one of the challenges was really to make my way across the organization, articulate the need, and really get a consensus around managing this issue. And I'm really proud to say that the organization has embraced this. We have a number of people attending this event tonight, which is a great event. And I'm really proud that the organization has been so accepting of the need for providing more dental care for people with disabilities.
So your organization actually played a leadership role in being one of the first major organizations who pay third-party reimbursement to accept and acknowledge this demand as well as the need. So what was I heard that the third challenge was that you have a large network of providers, but they might not have necessarily learned some of the technique for non-sedation treatment in their offices. And how did you go about addressing the education and training needs of your existing providers?
Well, I think that's the ultimate issue. Access to care really becomes the ultimate challenge. So we've created some training programs. And one of the training programs is I'm really proud to say, a collaboration in this market between Penn and Temple dental schools. We have 2 deans who are really outstanding champions of the need to do this. So the deans and their staffs literally worked for months to develop a program which was offered, a 4-hour CE course that was offered in Philadelphia at Temple Dental School on a Friday afternoon and at Penn Dental School on a Saturday morning. We had over 80 dentists from the community who attended.
Very impressive.
Penn has the course online, so it's available to be seen indirectly, and I think it's a great start. We are also looking for additional ways and additional collaborators to continue to support this network. You know, we understand after a lot of conversation, including conversation today, that the challenges in dental education are not going to be immediate, they're going to be longer term. The issue nonetheless is immediate. Now we have to do what we can to be able to provide the expertise and training and comfort level to the dentists in the network to facilitate them being part of the solution.
What role do some of the other stakeholders in the network, not your provider network, but the community network or the coalition network, what are some of the other things that perhaps parents or caregivers could get involved with? What are some of the other roles that an NGO or a philanthropy could get involved in helping address the access issue for oral health for this population?
Well, I think this coalition really was intended to be as broad-based as possible. And certainly the providers are part of that. You know, what we don't realize and think about is that dental providers are members of the community like anybody else. And to me, they really have an obligation. And that's really what we've been trying to articulate, that there is a public health need that needs to be addressed. You know, we think we as a company are addressing some of the tangential issues around reimbursement and around education and training, but ultimately it has to be a dentist who's willing to step up. So what we get from our coalition is really a knowledge. You know, we have 12 or 15 different disabilities that we're considering under this umbrella that we're trying to provide additional care for. We want them to be able to articulate the specific needs of those cohorts, give us the feedback of what it means for somebody with a physical disability as opposed to a developmental intellectual disability, as opposed to an acquired disability, as opposed to a behavioral health diagnosis. these are all conditions where dental challenges exist, and yet they're very distinct and very disparate. So a lot of feedback from those cohorts.
Do you think that this program would be replicated by your company and or other third-party payers in other areas? You're creating a model, you're creating a reproducible experience. From your company, are you going to roll this into other markets? Is that a possibility? And if so, what should we look for?
That really is the intent, Steve. And there are challenges in all markets, and particularly from a reimbursement perspective. We happen to have a fairly robust adult dental reimbursement model. But I think in conversations internally, there's enough interest that we would like to take this in other markets. And that really was the idea, is to create a model that is transitional, that is scalable. And that really is our hope.
So really, you've created a model for the various stakeholders to get involved. And it sounds like you're open to sharing some of your knowledge and experience with others.
Absolutely. It takes a village.
It does take a village.
And even in the year and a half I've been involved with this, it's been heartening for me to meet so many different stakeholders who are so willing to share. And that really is how this problem is going to be licked.
Right.
Nobody can work in a vacuum. We certainly don't have all the answers. Nobody has all the answers. It's going to take a great deal of collaboration, and we certainly do want to be a part of that.
Well, thank you, Larry. It's great talking with you today. What I'm hearing is you are involved. You're involving as many of the stakeholders as you can, and part of Schein Chats today is to get you who's watching this interview to get involved. Check us out, Project Accessible Oral Health at the Viscardi Center, and kudos to you and your organization for being one of the first to step in and step up. Thank you.
Thank you, Steve. Pleasure.